welcome to this week's Info Corona special. And it's a special on a special state. There was a time when Kerala was seen through the prism of its low economic development. But at the moment, Kerala is the state that the nation is looking to for answers to the coronavirus crisis. It's the only state where the coronavirus cases have come under control. Remember, the coronavirus crisis in a way started in Kerala. One of the first cases came there. But the scenario has changed, and changed dramatically. Even as a nationwide response is still being struggled with, Kerala seems to have put into practice an efficient strategy that has kept mortality levels down among the lowest, not just in the country, but indeed across the world. Today, we focus on the so-called Kerala model that is now being emulated by different parts of the country and the world. Is there anything special to it, or is it simply larger investment in public health? Let's focus on the Kerala model.
The first case of COVID-19 in India surfaced in Kerala on January 30th, 2020. Imported from Wuhan. But even before patient 0 had stepped off the plane from China, Kerala has already opened special control rooms and started taking precautionary measures. Almost as soon as the disease was being reported from Wuhan.
We have very good planning earlier itself. As you say, Nipah incident is a very good experience to us. With that experience, we have planned everything earlier.
By January, the state had started airport screenings and tracing to isolate persons suspected of being exposed to the virus. By February, protocols were established for a response team to coordinate with public officials across the state. On March 10th, Kerala shut down all educational institutions and entertainment centres, banned large gatherings and appealed to people to avoid visiting religious places. It was a day later that the WHO declared the coronavirus a pandemic. Kerala government ordered a strict lockdown in the affected districts much before the national one. Along with the lockdown came policies to counter the spread and combat the virus on a war footing. Essential supplies were home delivered. Midday meals were still sent to school children even when schools were shut. The Break the Chain campaign was particularly successful. Kerala earmarked hospitals in every district that were to deal exclusively with COVID-19 patients. Hotels were turned into isolation wards.
We are right now in Thiruvananthapuram, in the state capital of Kerala, and the police personnel, they are on duty day in and day out. They are working round the clock.
The swift action of the state government in identifying the possible social contacts and subsequently tracing them started to show results by early April. And throughout the growing crisis, this southern state never let up on the rate of testing. Till date, it has maintained the highest rate of testing in the entire country.
Now, as Lockdown 4.0 has been implemented across the country till the 31st of May, most states are slowly announcing the relaxation of curbs. But perhaps here too, Kerala has been a step ahead. It seems to be ensuring that the relaxations take place in a manner that it is not disrupting the fight against COVID in any manner. What is it again about Kerala that puts it a step ahead of the rest of the country? Our correspondent Gopi Krishnan Unithan has this special report.
With the easing of curbs in Lockdown 4.0, Kerala is slowly moving towards new normalcy. Vehicles are now back on the roads and people are out for their walks. The state government has decided to open public transport in a restricted manner. Initially, bus service will be allowed within the districts, However, interstate bus services will not be operated as of now. And private vehicles too have been allowed to ply without special passes.
To ensure social distancing, people will not be really allowed to crowd inside the buses. Staff members, be it the driver or the conductor, they have to ensure that they actually follow the social distancing norms, and they will also have to put on their mask.
Taxis can now operate with 2 passengers in Kerala, but pillion riding is allowed only with family members on 2-wheelers.
You will have to get this electronic receipt before you can commence your journey. So right now I'm just going to one of the nearby junctions and I'm taking my camera person alongside me. Okay. Oh, so that's actually a very innovative way. He's actually giving me some hand sanitizer.
The state government has allowed opening of 50% of the shops in shopping complexes on alternate days. Salons and beauty parlors have been given the permission to reopen. But only haircutting and shaving services are allowed. That too with necessary safety precautions in place, no air conditioning and not more than 2 people in queue.
I'm going to show you what it will be like to come to a hair salon after the post-COVID-19 lockdown era. We are not completely out of lockdown, but still. Now I can actually go inside. Now they have actually checked my temperature, they have given me hand sanitizers, they have given me a fresh mask, and now I am allowed inside. And also outside they have actually written the normal standard operating procedure for this. This is exactly what the Chief Minister also said yesterday. After each customer comes and use this space, they will clean these chairs because this is where most of the contact happen, and that cleaning will be done with isopropyl alcohol, and those seats will be completely clean with that, and only after that each person will be allowed to sit in those chairs.
However, schools, colleges, training centers, gyms, malls, theatres and religious places will remain closed for now.
And joining me now as we focus on this Kerala model and what Kerala may well have done right is the woman who is now making all the headlines. K.K. Shailaja, the Health Minister of Kerala, is joining me, also known as Shailaja Teacher, because she was a teacher before she became a politician. Appreciate your joining us, ma'am. Thank you very much for joining us from Thiruvananthapuram. The Guardian has a big full spread on you. The BBC has interviewed you, The Economist, Wall Street Journal. Everyone is talking about you and the Kerala model. I want to understand, do you feel proud of what the state has achieved in a way? Do you think the job is done, or is the battle still far from over, the fight against COVID-19?
Yeah. Everyone around the globe is listening to everywhere and anywhere whether they can get a solution to contain this serious thing, the novel coronavirus. And everyone are watching thoroughly from where we get a positive thing to tackle this problem. And that's why they listen to Kerala also. In Kerala, we have framed a very good preparedness and standard operation practices, and we are working hard to tackle the problem. And we can say that the first and second phase, it was a success, and we are facing now the third phase, we can say so. And if it become a model, we are very happy to introduce this thing to all of the world, all over the world. But it is not an easy thing, you know. In Kerala also, we are struggling hard to maintain the this flattening of the curve and other thing, and we are trying our best to reduce the mortality rate and flattening the epidemic curve.
You know, ma'am, you said that Kerala is at a stage where you're hoping to flatten the curve. But the worry, of course, is as you open up in the last week, public transport back, barber shops are open, large numbers of people are now coming in from the Gulf on flights. Does it play on your mind that maybe Kerala has opened too much too soon, that there could be another outbreak that you could be facing in the days and weeks ahead?
Yes, this is a challenge actually, because we have to balance these two activities. One side we have to contain this virus, other part we have to open the lives and livelihoods and we have to work. And the balancing act is it is not easy, but we are doing that. We are giving strict instructions to people. First of all, the first thing is to break the chain and to assure that the hand washing and social distance keeping and also wearing mask when they are coming outside. And the other thing is the positive cases or the people who traveled from outside, people who returned from other countries and also from other states. We insist strict quarantine to them, and some persons we are having the institutional quarantine and the others in home quarantine. To insist the home quarantine, we formed committees in each and every panchayat wards, and with the help of local self-government, the people's representative, ASHA workers and policemen, we are making it sure that the people are obeying quarantine principles, quarantine guidelines, and they are not jumping. That is a difficult task, but we are doing that. Creating awareness among people is the very important thing. We have to live with this virus. We cannot close down everything for any or every time. We have to open this thing, but we have to follow strictly the stringent actions, strict isolations and quarantine. We have to follow that. We are doing that hazardous job here, and with the help of people-centered method we are implementing, and with the help of people, we are sure that we can yield good results.
You know, Ms. Shelja, your critics in the opposition are saying that the left government and you are doing a lot of PR work. That in any case, Kerala has always had a very strong public health system. You claim you have 2.5 lakh quarantine beds and yet you are asking people to stay at home. So they are saying that this is a lot of PR. You are on the front pages of a lot of international papers, and that is largely because of what Kerala has achieved, not because of what Shelja has achieved.
Sardesha ji, I didn't know what they are saying. Did I call you for anything to publish in your media? I never asked you. You called me and asked something about Kerala. Same way that all other medias and television medias and newspapers, etc., Guardian. I didn't expect a call from Guardian, but they called me and asked what you are doing in Kerala. I just answered. I never called Guardian or any other world media. And what is the PR work? I don't know. I have no one here to have PR work. Only me and my office staffs here.
You know, whether it is PR or not, at the end of the day, I read these newspapers which are calling you as the woman who has helped conquer Corona. Let's look at the secret. What do you think is the reason for the success of the Kerala government, of the community system, public health system? What is it about Kerala that you think other states can learn from?
Sir, this is not my own work. I can't say so. A single person cannot do anything. I am health minister here, and I am organizing my department and coordinating my team to get good result. But our chief minister is a brave man, a man of decision making, and he is in the forefront. He coordinates all the other line departments and conducting meetings and foreseeing what happens to Kerala and what measures we should have to take. And in one part we should contain this virus, on the other part we should feed our poor people, and we should maintain our everything we should have to do.
You know, let me slip into a break because I want to talk about how you have gone about testing. Kerala's track record on testing in particular is really what sets you apart. tracing and testing. We'll take a break. KK Shelja is going to tell us also how she manages her personal life amidst the crisis. What is her advice to other states? Back in a moment. You're watching this Info Corona special, and we are focusing on the state where all eyes are on a particular minister. The health minister of Kerala is with us, and remember, several health ministers are seeking her advice at the moment in the fight against corona. I want to ask you, KK Shelja teacher again, what is the model now as you enter lockdown 4? How is it different from the previous model? Do you continue to increase testing because Kerala has been testing aggressively? Will you follow the same policy of aggressive tracing and testing?
We are continuing the same policy, that tracing, testing, quarantine and treating. But we are slowly increasing the test. We have to conduct more sentinel surveillance tests, some pool tests among the health workers, and sentinel surveillance test, sometimes a bulk test from some hotspot. That we are increasing, but it is under our guidelines, the previous guidelines itself, but we are containing more sentinel surveillance tests because we want to know whether community spread is happening or not. Another thing is we are testing all the peripheral pneumonia cases. We are eagerly watching whether the peripheral pneumonia cases are increasing. Up to today, it doesn't increase. No new cases of peripheral pneumonia case, no increase in peripheral pneumonia case in the villages or in the cities. But
I have to ask you this, KK Shelja. I'm told your personal and family life has taken a hit. You're a grandmother and you barely had any time to spend with your granddaughter. I believe you actually met her only after almost 3 months. For around 3 months you were out of the house, and then you had to go back to Thiruvananthapuram. Has this been a very difficult 3 months away from your family fighting this war against COVID as health minister?
Definitely, as any other family, every family members are like me, I think so. And I also was very unhappy to living away from my granddaughter. She's a cute girl, and sometimes I feel missing her. But it is my duty. All my family members agree that they are saying, no need to come here. You stay at your headquarters and work for this tackling this virus to save the lives of people. And they are very cooperative to me. My husband, my son, and my son, daughter-in-law, and my little one. Little one was a little unhappy that her grandma, he's seeing her grandma only in telephone, in WhatsApp or like that. But physically she cannot touch me. That is a problem. But I didn't take it a great problem or difficulty because I am doing my work to my society.
I know, of course, you started your life as a teacher. That's why you're called Shelja teacher. Let me ask you, therefore, one final question. A lot of states have been talking to you. I know the Maharashtra health minister had a video conference with you a few days ago. What is that one advice you are giving other states, or dare I say tomorrow other countries, that you have learned from the experience in Kerala?
Yeah. You see that ours is only a small state in a country, Kerala. In India, we are a small state, and we are no one to advise the whole world. But a method we following, we are enthusiastic in that method. And if anyone wants to follow that method, definitely they can follow. But we have a system here. We created a system previously, and also we are changing something in the health sector. I have one thing to give their attention to that everyone should work to have a very good public health system and primary health system, people-centered health service in each and every country. That is the answer. That is the only answer to improve our public health system, affordable treatment to affordable healthcare system to all the poor people. It should be an equality-centered approach, not only for the rich people but also for the poor people. We should look at them. We should focus on that poor people. They should get affordable healthcare system everywhere. Definitely in the village level, in the grassroots level, in their doorstep. they should get a very good healthcare system. We are preparing for that. We are doing that, and we are improving that system. All the world countries should find out this. Not only the insurance or like that, they should find out that the public healthcare system should be developed, and people-centered system should be developed, and the expenditure in the healthcare system also should be increased. Our country also should increase. Our country is spending only 1% of the GDP in healthcare system. It should be increased. 10 or 15% should be spent for public health system. And all the other countries, not only spending but also to build the people-centered, people-friendly public health system in grassroots level. That is the only answer to prevent this kind of deadly, contagious things.
That's right. You've spoken well. Dr. K.K. Shelja, you've given us a sense of why Kerala is perhaps a step ahead of the rest of the country at the moment. Invest in public health system. That's what will keep you a step ahead in this fight. Thank you very much for joining us, and continue, of course, fighting the battle against COVID. That's it on this Info Corona special, where we turned our gaze to the Kerala model and the minister who's making the headlines. Thanks for watching. Bye for now.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.